Thank you, Michelle. We know that for many, anxiety, depression, and fear of reoccurrence are just a few of the disorders and feelings survivors have even after the fight for their life and beating breast cancer. There are numerous studies affirming this lack of awareness in addressing the mental health of survivors, and yet it continues. Why is this the case? Oftentimes, providers have difficulty in determining and differentiating mental health distress. As it stands, there is a lack of consensus among healthcare professionals regarding how to define or even measure the presence or absence of psychological responses. According to a national survey, 1/3 of oncologists do not even screen their patients for signs of distress. And of the doctors that do screen their patients, 65% utilize methods that were untested or unreliable. In addition to the lack of consensus on how to measure psychological responses and the lack of screening, providers may underestimate their patients' psychosocial distress. They often attribute anxiety and depression to be side effects of their treatment and not the patient's actual mental health state at that time. Another contributing factor to the lack of awareness is the lack of education and training. Essentially, what we are seeing is that the psychosocial healthcare needs are not well addressed in their care. Their needs are not being met simply because many providers do not understand the survivor's psychosocial needs to begin with. The focus for oncologists after a patient has been diagnosed is beating the breast cancer. Attention to any of the factors beyond their direct medical care is lacking. Many providers simply do not even consider psychosocial support to be an integral part of the care they provide to their patients. Not all oncologist providers ignore the mental health state of their patients, yet they're simply just unaware of the healthcare resources available for survivors. Fundamentally, there is a failure to recognize, adequately treat, or offer referral for depression, anxiety, or other disorders and illnesses that occur after remission. In order to address the lack of awareness in breast cancer survivors, mental health providers need to overcome the difficulties in determining and differentiating mental health distress, as well as their lack of education and training in meeting their psychosocial needs. Now that we have covered the causes, Ivy May Carrillo, certified oncology psychologist, is going to discuss some of the possible solutions.